How to treat patient with post-stroke and subluxation in the shoulder. This question might have crossed your mind many times, but you might be confused at what can be the perfect treatment for the one. But don't worry about it. This Physioquest series, this question, I'm going to discuss about all of the situation and what can be the best treatment for the patient. Hello everyone and welcome back to my channel Physio Trends. This is me Physio and this is Physioquest series 2.0. If you want to watch more questions like this, then you can go to the Physioquest 1 as well as 2 on my YouTube channel. Separate playlists are there. So let's discuss about today's question, this week's question. The question information given to us is that patient is 1 month back, patient got right side severe because of that left side weakness is there. Another important information is that patient is having predominant spasticity which is moderately high on the flexor component. Third information is that patient is having subluxation of the shoulder which is almost 1/4 of the inch that we can notice. And another information is that patient is not having much of voluntary control and we need to find out the best treatment for this situation. So I hope that you have understood the question now, and let's go to the answers, what options we are given. The first option says that patient will be in sitting position and patient will try to protract the shoulder. Along with that, patient is going to perform the flexion at the shoulder which is 90° with extended elbow. Now my dear friends, there is nothing wrong in this position, but here we need to keep this in mind. The information given in the question says that patient is already having spasticity more in the flexor component. So if you perform this activity, you are going to increase tone in the flexor component more and more. And it is not going to help you anyway about the subluxation in the shoulder. So I don't think this option can be the correct one. Let's go to the next option. Next option says that patient again is in the sitting position. And then you ask patient to weight back on both the shoulder with extended elbow and shift the weight from one side to the another side. Now this makes sense to me a little bit because what happens that when you are weight bearing on your shoulder, basically you are also lifting the head of the humerus upward. You can give compression on the joint which helps for improving the subluxation situation, as well as in this, because you are not performing any flexion in the shoulder, the flexor muscles are also getting stretched. So this might be a correct option, but we will see what other options have to say and then we will decide which is the exactly correct answer, because we have to decide which is the best treatment in this situation. The third option given to us is that you make the patient in quadruped position and then you do the weight shifts from one side to another side. Now my dear friends, it is kind of the situation given in second option, but here you are putting more weight on the joints which is shoulder and you are then trying to shift the weight. Now in this position already we know voluntary control is less. Plus when you be in quadruped position, your shoulders are already in 90° of flexion. So again this situation becomes like the first situation where shoulder is in flexion. So you might increase spasticity in these muscles and you might not help more because already subluxation is there. So again this option also doesn't look suitable for this current situation. Let's see what the last option says. Last option says very basic, PNF D2 pattern. Now D2 pattern is something like this and this. So this pattern definitely when you lift it up for the flexion, abduction, external rotation, this is a good activity for stretching your flexor component, improving the movement for the patient and reducing spasticity in the flexor component. But this also includes this movement which is like adduction, internal rotation and also extension of the shoulder. Now when you are doing this, this might disturb or this might increase your subluxation in the shoulder. So this is what we have to keep in the consideration, and that is why this cannot be the best option right now. The only best option which we have discussed is option B, which is sitting position, shift the weight from one side to another side with weight bearing, elbow extended. So I really hope that you have understood the answer and concept that why we should give this exercise when patient is post-stroke plus subluxation for the best results in the patient. If you have any doubts, anything, you can comment down and let me know how you like this Physioquest 2.0 and what more we can do in this Physioquest series. Till then, thank you so much for being here on Physio Trends, and keep watching Physio Trends, keep sharing Physio Trends with your friends for better reach.